Hi everyone, today I am giving you information on the topic retinoblastoma. So let's move to its introduction. Retinoblastoma is an eye cancer that begins at the back of the eye. So it is a kind of the eye cancer and it looks like this. This one is the retina and this one is the optic nerve, and the eye cancer looks like this whitish area. Okay, so this one is the retinoblastoma. It is intraocular and hidden, begins at the ora serrata and seen before 2 years of age. So it is again that kind of disease which occurs in children. It is intraocular, means it is present inside the eye, and hidden. It remains hidden until it comes at the outside of the eye. Okay, and it begins at the ora serrata area. Ora serrata area is that area where the ciliary muscles as well as ciliary muscle and the retina formation start. So it is a junction between the ciliary muscle as well as the retina. That area is the ora serrata. So this this tumor began to form at the ora serrata area and seen before the 2 years of age. Retinoblastoma increases from the superior and inferior because at ending of the ciliary body and the retina are thin. It begins at the ora serrata area because the ending part of the ciliary body and the starting part of the retina is the thinnest part. So from where it begins to start. Next one, genetics. Now what all things are responsible for it to cause? First one is the genetics. Genetics is the main cause. Retinoblastoma results from malignant transformation of primitive retinal cells before final differentiation. So before final differentiation, these primitive retinal cells go under transformation and retinoblastoma forms. These cells disappear within the first few days of life because it occurs in children, and predisposing gene which is responsible for it is 13q14. Next one, heritable. Some amount of it is heritable. It accounts 40%. In 40% people it is heritable. Risk transmission of gene mutation is 50%. Okay, so gene mutation risk is 50%. Unaffected parents of a child with bilateral retinoblastoma with no family history have 40% chances of producing another affected child also. Parents are unaffected and a child they have produced is having bilateral retinoblastoma and there is no family history of retinoblastoma, they also have the 40% chances of producing another affected child which consists of retinoblastoma. So this one is the heritable. Let's move to the next, which is non-heritable. Retinoblastoma accounts 60% in cases which is non-heritable. Tumor is unilateral, means it is present only in one eye and non-transmissible. 80% of the patient with unilateral RB fall into this category. Okay, so if it is heritable then it affects the both eyes. If it is non-heritable then it affects single eye. Presentation, majority of presentation is first 2 years of life because of the primitive cells. It occurs due to the differentiation of the primitive cells, so it occurs in the first few 2 years of life. Children with bilateral tumor tend to present earlier. If the children have a bilateral tumor, then it will represent earlier. Leukorrhea is a whitish reflex in the eye. So leukorrhea looks like this. This eye is glowing and it is a normal glow inside the eye. Retinal blood vessel starts glowing and this is a whitish reflex which is showing, and it is a sign of retinoblastoma. Strabismus means misalignment of eyes may be seen in the patient because this eye is not be able to see. So the eye tries to see, and as in order to see the eye becomes misaligned itself. Secondary glaucoma associated with ophthalmos due to inflammation cause ciliary muscles. Ciliary muscles become inflamed and formation becomes disturbed, due to which the secondary glaucoma associated. Orbital inflammation, the orbit in which the eyeball is situated, so it becomes inflamed, due to which retinoblastoma occurs. Metastatic tumor involving lymph node and brain to the optic nerve, and it gets spreading to the optic nerve also through the lymph nodes. Raised intraocular pressure become raised, due to which there become a secondary glaucoma. Anterior chamber, cornea and lids get swell up. Rarely the lens gets swell up. So this one is the image of the retinoblastoma. Next one, diagnosis. How we can diagnose it? Indirect ophthalmoscopy with scleral indentation. we will do the IO. So the retina specialists are required to do the IO, indirect ophthalmoscopy, in the children with scleral indentation. So no any other part of the retina will be missed out. So we use the scleral indentation. Slit lamp examination. On the slit lamp examination, we will find out the any abnormalities in the iris, like secondary glaucoma in between the chamber of the cornea as well as the iris, lens abnormalities, etc. Rubeosis iridis is the new vascularization on the iris. Hyphema is the blood in the interior chamber. New vascular glaucoma, new blood vessels start screwing, due to which the glaucoma occurs. Clear lens, rarely edema. So all these things we can see on the slit lamp. Treatment. Now, what is the treatment? For the small tumor not more than 4 mm in diameter and 2 mm thick, we will do cryotherapy or transpupillary laser. Medium sized tumor not more than 12 mm thick and 6 mm, brachytherapy and a chemotherapy is done. For the large tumor, chemotherapy is done. Enucleation, removal of the eye, is done in 14 mm in diameter and 8 mm thick. So this is all about the retinoblastoma. Thanks for your patience.